you walk me through the process of wanting an implant or needing an implant to actually getting one placed, and then the healing process of what that looks like after?
So if a patient is missing a tooth, they have the option of getting a dental implant, which nowadays is such a simple procedure. What we do is we take a CT scan and we do a digital scan in the office. We design the whole surgery before we actually do any kind of work on you. So we do a lot of homework, and we have the right dimensions, the depth and the height, the width of the implant. We have a surgical guide ready for you, which is already printed, and actually it guides the drill right into the exact location. The nice thing about this way is that we are not having to pick up a scalpel, and it is very comfortable for our patients and to the tissues. So because we're not cutting, the healing time afterwards is very quick. What we do is once an implant is placed, we just put a cover screw over it, allow the gums to just heal, and within a couple of days, our patients don't even know that anything even happened. It's simpler than taking a tooth out.
Really?
Yeah, it's simpler than taking a tooth out. It is that simple. What we need to do is just make sure that the implant heals for about 3 to 4 months.
Would you put a crown on top of the screw at that point, like a temporary? Or does the bone have to heal around the implant first before that's done?
So the bone, it's kind of like, you know, you get a broken bone and you're put in a cast, and the bone has to heal within that cast, you know, say 12 weeks. The same thing with an implant. The bone has to grow around the threads of the implant. That needs to be done in an undisturbed manner. So I don't generally put a crown in that same day because I want to have stability, and I want to have a good prognosis. Now, if it's in the front and your bone is good, we can talk about getting a temporary solution for you. There are many different ways we can get a tooth there temporarily, because I know that's your front tooth. So yeah, we can help you out in that regard. So,
okay.
But we want to just keep that implant secure.
Because now that I think about it, like having the missing front tooth, like
we have removable options, but then we also have an option that we can use the implant as a fixture to screw into the implant. We reserve those for when the bone is adequate.